thank you all for joining us tonight, and for our organizers who are Global Food Security and Public Health, School Public Health, two centers that promote and support interdisciplinary research at the University of Cambridge. Please do check their websites to find out more about them. My name is Giles Yeo, and I'm your host for this evening. And I am a geneticist I'm a geneticist at the University of Cambridge, where I specialize in how our brain controls food intake and in the genetics of obesity. But me tonight, I am in the same boat as everyone else here in the audience, in that this area of childhood, of child poverty and food poverty is not in my wheelhouse. This is not my area of speciality, whereas we have the most fantastic panel tonight. And today is International Women's Day, and we have the most amazing, I've never seen so many directors and executive directors and very senior type XX people in my entire life. And so I just want to very briefly introduce the panel to you, but I want to tell you how the evening is going to go as well. So we're going to spend the first 15 minutes. I'm going to let each panel member set out their stall. They're going to be speaking for 2 to 3 minutes. And so that you get an idea where they're coming from and what their role in this space is. During this time, and will take about 15 minutes, as the panelists are going through this, please do put in questions into the chat. Okay, I will try and sort this all out later. And then the next 20 minutes after the 15 minutes of introduction, we'll then have a discussion of all the panelists, and you can continue, please, the audience, to keep putting questions into the chat. And then I will then open questions to the floor and try and actually deal with the questions as and when they come. Okay, so can I please remind everyone to please keep yourself on mute and to turn your cameras off so that we can see the panel, and that will be fantastic. So let me introduce the most fantabulous panel that I've ever seen anyway. So first of all, we have Yolande Wright, who is a Global Director of Poverty Reduction, Climate Resilience, as well as Gender Equality and Inclusion. Okay, at Save the Children, ladies and gentlemen. That's right, Yolande Wright. Then we have Professor Tamsin Ford, who is a professor of child and adolescent psychology here in Cambridge, who's interested, from the title, in the mental health of children and young people. We have Claire Thompson, who's a senior research fellow at the University of Hertfordshire, who researches place-based equalities, particularly in relation to food, health, and well-being. We have Anna Taylor, who is the executive director of the Food Foundation. And then we have Sam Dyer, who is the CEO and director of Cambridge Sustainable Food. And so I'm looking forward to this discussion. And so let's start with our opening statements, our soapbox. So Yolande, why don't we start with you? How is this in your wheelhouse?
Hi everyone, can you hear me okay? Fab. I'm hiding in the bedroom because all the kids are home from school. They went out today. So my wheelhouse covers like global child poverty and hunger. So I'll give a couple of my big picture things, and then obviously in 3 minutes I can't cover it all. But I mean, one of the things to say is that COVID, we were doing a reasonable job of reducing child poverty and child hunger globally. But COVID has certainly thrown things into disarray and has unfortunately increased the number of children suffering from multidimensional poverty, and is likely to increase the number of children suffering from malnutrition as well. So kind of there's no room for complacency, and particularly we know that in some of the hardest to reach places, children are really left behind. So one of the things that I find shocking is that still, as we ended 2020, 1 in 3 children in the world were malnourished, either stunted, wasted, or overweight. So in one way or another, malnourished, and about half of all deaths of children under 5 are linked to undernutrition. So, and we know that child poverty isn't just about monetary poverty, it's about a whole range of things that help to make good lives for children and help them reach their potential. But these are all things that I think, you know, should be making us all think, what's going wrong? What's going wrong with our food systems, our governance systems, our prioritizations, that this is still the situation for children in the world. I could talk about how poverty affects children and their life chances, but I think many of other speakers might cover that. But we do know that, you know, from talking to children living in poverty in rich and middle income and low income countries, that there's huge problems, not just cognitive issues. You know, it's so important in the first 1,000 days to have a sort of nutritious diet that helps you with all your development and cognitive function. There's the stigma that they suffer from the different types of interventions. Some of them actually increase stigma. So one of the things that Save the Children tries to push for is kind of universal systems that apply to everybody and reduce those kind of issues around targeting and, you know, you're in and you're out of systems. So in my last 30 seconds, I will just plug one of the things that we're pushing for in terms of responding to this huge challenge is that we should expand social safety nets. And what I mean by that is things like child benefits that we have in the UK, or universal credit that we have in the UK, to make sure that every child that needs it is reached and that they are at an adequate level. And we don't think that's just a rich country thing. We think actually that's a solution that could work in a huge range of countries. And by creating that compact between the government and the citizen, by saying, we know bringing children up is expensive and we want to support you in that difficult time when you are bringing children into the world and when there's a higher care burden, when perhaps both adults can't work, we'll provide you with some kind of cash to help you through that difficult time. And we think that can be really important in conjunction with lots of other support. You obviously need other types of things, infant and young child feeding practices, support to good parenting, etc. But we do think cash is a really well evidenced way of helping to reduce child poverty and hunger. I'll stop there because that's 3 minutes 30 seconds, but that's a brief bit of my stall. I hope that gives you some hooks.
Thank you so much, Yolande. And Tamsin, can we hear from you?
Yes, of course. So my background is child and adolescent psychiatry. So although I am a clinician by background and unusual as an academic in that I did all my clinical training up to the point I had a piece of paper saying the GMC were willing for me to be let loose as a consultant before doing any serious research. My research focuses on optimizing services and interventions for children across the whole range, from thriving to those with poor mental health. In terms of feeding and eating, there are strong links between mental health and appetite and weight. If you are overweight or obese, it's likely to impact negatively on your mental health. And similarly, both anxiety and depression can lead to loss of appetite, loss of weight, and obviously there are eating disorders. We are not doing well in terms of children and young people's mental health. It was deteriorating prior to COVID. And although there's a mixed picture, I suspect you can detect over average a deterioration in mental health for all age groups, both genders. We only asked about 2 genders. We're trying to chivvy people on to be a bit more progressive, and all ethnic groups. Clinically, there has been a massive rise in urgent referrals for eating disorders amongst children and young people, which is accompanied by a similar rise, but not quite as marked, for routine referrals. So what we are seeing, we think, is children and young people's eating has been thrown out of kilter by the pandemic and the restrictions associated with it, combined with a reluctance to seek help and the fact that children aren't with their normal support networks, so that they're presenting later and they're in greater physical and mental distress when they do present. And I think that's enough from me.
Thank you so much, Claire. Tamsin, sorry. Thank you so much, Tamsin. Claire, you're next. That's what I meant to say. Apologies.
Thanks, Giles. Yeah, so my background is in research on experiences of food poverty and food banking over the last 5 or 6 years. So to start with, in London, and more lately in the east of England. working with local authorities around food poverty action plans and what sort of locally coordinate responses there is to food poverty. So I suppose my bugbear with it is around poverty and around precarity. As Yolande said, it's not just about food, and it's about poverty, but it's about a particular type of poverty often, and that's a precarious existence. So I think a lot of the interventions or the help, and it's well-meaning and it's important, especially around helping people cook better and budget better, and all them things are valid and they all have a place, but they all become they'll become a bit less meaningful if people don't have security around the social determinants of health. So if they don't have security around particularly their housing, so they've got somewhere secure and relatively okay to live, and they've got a relatively stable income, and they know it's not going to get taken away because of their hours, because of their benefits, it's much easier to intervene and to help people do better with food. Without that, what you're eating and whether or not you're having a nutritious diet, if you don't know how you're going to keep the roof over your head or what your income's going to be next week, that stuff kind of just falls further and further to the bottom of your pile of priorities. And in the longer term, especially in households with children, that's not a good thing.
Thank you so much, Claire. Anna.
Hi, everybody. So we've been doing a lot of tracking of what we call food insecurity or food poverty in the UK since the start of the COVID crisis, and been particularly asking about people's experiences of what we call moderate and severe food insecurity. So that's skipping meals, going for a day without eating, or going hungry, specifically because you're not able to afford or access food. And the very latest data, which we gathered at the end of January, shows that 9% of adults have had those experiences in the last 6 months, about 12% of households with children. And that amounts to about 2.3 million children who are in households where adults are reporting food insecurity. We've also asked children specifically about their experiences, focused on children aged between 8 and 17. And we asked them about their experiences over the Christmas period, so about a 6-week period ending mid-January. And 1 in 5 children had some experience of mild or moderate or severe food insecurity. So this is things like being sent to relatives because there's not enough food at home, seeing your parents cut back on food, you yourself not eating because you don't want the food to run out, a set of, or cutting back on the size of the amount that you're eating because you don't want the food to run out. So these are children telling us these things, and about 1 in 5 children have reported those experiences over the Christmas period. And we also asked them about visiting food banks. 13% of children had either visited a food bank over that period, or had their parents or family members had visited a food bank. So this is a really sort of significant number of children who are living in households that are affected by food insecurity. And as Claire says, it's a sort of marker of not just poverty, but quite extreme material deprivation that these households are experiencing when they're getting to the point where they're cutting back on the volume of food that they're eating. I think the other thing that we've looked into quite significantly is, as Yolande said, totally support the sort of the safety net, and the fact that we've got really quite significant gaps in the safety net in the UK at the moment. And Marcus Rashford's campaign around free school meals has highlighted some of that. But we've also got, alongside that, a food system which makes the cheapest food the least healthy. And so if you're in a situation where you've got very little money, and you're often, for a whole host of reasons to do with money, but also your housing, which I think Claire mentioned, and your desire not to waste food, might be in a situation where you're reliant on very cheap sources of calories, which at the same time are doing damage to your health and the long-term health of your children. So we've got a situation where we need to fix the income problem with the safety net, and we also need to fix how the food system is sort of incentivizing the wrong types of diets. And if we deal with both, then we might be in a situation where we can not only tackle, you know, food insecurity, food poverty and those things which I talked about, but also tackle the big marked differences in obesity that we see between the poorest children and the richest children in the country. Thanks.
Thank you so much, Anna. And last but definitely not least, Sam.
Good evening, everybody. Thanks, Giles. Happy International Women's Day to everybody. I'm going to talk a little bit about the response in Cambridge, so very much from a community response and what's been happening and some of the findings and experiences that have come out of that. First of all, I wanted to share a very small story with you. So recently, interviewing a woman, a mother of 2 children, about her experience of food poverty. I was deeply moved to when she had this light bulb moment, and the light bulb moment was when she realised that the tactics she was using to make sure her children, and in fact her husband, got fed before she did, were the same excuses and the same tactics that her mother had used. She hadn't really realised or thought it through until that point. So for me, she was saying things like, you know, I'm not hungry, or I'm busy in the kitchen right now, or I'll eat later. Those types of things that are avoidance that send signals that, of course, she's not going to eat later, or if she does, it will be stuff that gets left on the plates. That's second generational hunger. That's learned behaviour, and it's women learning that behaviour in particular. And I'm sure she's not the only person, the only woman out there having learned that behaviour of her mother. So Cambridge holds the most dubious of top awards, being the most unequal city in the country. Many of you are nodding your heads. The difference in life expectancy from the most affluent to the most economically deprived is about 10 years. So in Cambridge, the Food Poverty Alliance was formed in 2017, sits underneath the National Food Power umbrella. And it was a response to rising food poverty in the city. It's an alliance of local authority and frontline organisations, including Cambridge City Food Bank, the local football, Cambridge United, housing association, churches, so very much cross-sectorial partnership. And basically what that meant was when the pandemic hit, the alliance response to that was quite collaborative and quite quick. So up and running very quickly, very early on in April, there was a distribution hub, 8 community food hubs that were run by volunteers and mutual aid groups, a signposting toolkit and an emergency phone line, and more importantly, we were just going into the Easter holidays, so the holiday hunger programme was switched to a doorstep delivery service. So the estimates on the number of children being supported each week through these measures is about 750 children and around 250 families each week through the hubs, through holiday hunger programme. And a further 179 received support through the Christmas period through a hamper project, which was a partnership project with other agencies, including Cambridge Food Bank. So what have we learned? Through surveys and questionnaires we've done with people that attend the hubs and how attend the holiday hunger programme, we found that families are using the hubs as a way to supplement other debts or other spending. 2 of the systems that are really set up to put money into people's pockets have proved to be inadequate just at the point of when they were needed. The first was the Edenred system that was issuing the free school meals, and also the Healthy Start voucher scheme early on. Amongst other things, they both issued paper vouchers to families at a point when people, I mean, I don't know whether people's memories go back to last April, but people were quite scared of actually handling paper. Let alone having a printer in the house to print those vouchers, or indeed any digital access whatsoever. So parents have told us about being turned away from supermarkets for bringing too many children with them, because you can't have that many children in a supermarket when you're only allowed one by one. During this particular lockdown, we've seen some issues with online school classes taking up much of the day. If you have 3 children and you're trying to get them all to do different times, then it's very difficult to get along to a food bank or a food hub access any support. The community centres, and I think this is something that Tamsin potentially touched on, was this, the usual services, the community centres have all been closed, and that's meant little face-to-face interaction. The holiday hunger programmes are not just about feeding people, but they're actually getting them face-to-face with community development workers and service providers that are able to, it's often a place where safeguarding issues are flagged to support services and support staff. So that type of support hasn't been there. For us going forward, we will be concentrating on getting money into families' pockets. I work for an organisation that, as it says, is about a food system approach, not just a food poverty approach. So looking at different approaches, whole food system approaches, and seeking to change the sort of the narrative to a food justice one. And obviously I'm just going to throw this question in there, but this idea around dependence and what do we mean by dependency? How is it built? How does that get broken? And I suspect that's to do with the financial approaches and putting money into people's pockets. Thanks, Giles.
Thank you so much, Sam. So folks, don't forget to keep putting your questions into the chat, please. We'll come to you in a bit. Anna, can I start with you? I know you've mentioned that you worked with Marcus Rashford, and that got a big a lot of press coverage about the fact that, oh, there was holiday hunger and these things were getting. This is going to be a very middle class audience that we actually have in front of us, and I think that many people are going to be shocked that this can actually occur today. In fact, when I actually was following the Marcus Rashford story, and you saw both responses, I have to say, from the government as well as other commentators, to say that, the parents, this is just bad parenting. They need to look after their own families. Why can't they provide food for them? Don't they have jobs? So I guess let's open with that. How do you tackle that argument? How do you explain what exactly food poverty, food insecurity is to people like us who cannot imagine what it is?
Yeah, well, I think sort of part of the reason why Marcus's intervention was so powerful, because he actually talked about his personal experiences. He talked about his mum doing several jobs and there still not being enough to put food on the table. And I think at the same time, Marcus, by doing that, sort of gave permission to other people to speak up. And we know that this is an area that people feel very ashamed about. I mean, in our data, just almost half of people who experience food insecurity don't want to ask for help. They feel bad asking for help. They feel embarrassed asking for help. We've heard that parents say they're worried that it might mean social services come in if they are, there's kind of like a whole set of anxieties around this problem that means that people don't talk about it. And I think to the point that you've said is that we've got quite a divided society now. And I think what in some ways, perhaps one aspect of COVID has been that we've talked a bit more to our neighbours, we've understood a little bit more about the communities that we're living in, and we also might well know people who've lost their job, who a year ago would never have dreamt of being on benefits, but are now trying to manage on the universal credit income that they're receiving. And so I suppose one bit of hope that I take from last year, and as a result of what Marcus Rashford's done, is that he has actually made a conversation about food poverty possible at the national level, which wasn't really possible this time last year. And I think the strength of public opinion that we saw with more than 1 million people signing his petition showed that a lot of people are worried about this. And they're in all parts of the United Kingdom, and they're in all different communities, and they don't think it's right that we're in a situation where children have these experiences. You're on mute, Giles.
sorry. I was unmuting and then remuting myself. I mean, I do think it is criminal. I want to try and take as apolitical a view as I can on this discussion, because I don't think that's necessarily helpful here. But I think a lot of it is down to and this is editorial now, an inability or a refusal, political inexpediency, I'm going to say. After saying I'm going to be apolitical, I wasn't. Yolande, can I actually point a question to you? I'm just picking up on something which I think I flashed up in front of my eyes when you spoke about the really strong gender dimension when it actually came, particularly over COVID, to job losses. I think I saw a figure in was it at the end of last year when they were saying in the United States there were 200,000 jobs lost or something like that, all of which were women, which is the most incredible number I have ever heard in my life. You know, how can 200,000 people and every single one of them was a woman? So, I mean, did you want to speak to that, to that comment that you actually made?
Yeah, sure. And again, I can't speak. I don't work on the UK, so there are others in Save the Children who do work on the UK. So I'm a bit of a global person. Sorry, but yeah. So globally, we did see in our global surveys that huge numbers of the job losses. So yeah, that statistic from America was apparently true, that those 140,000 job losses or whatever were women. I think it shows, as someone said in the chat here, that existing inequalities have kind of been just exacerbated by COVID. So lots of people in the UK and globally work in what we would call the gig economy, and in other countries often called informal sector, right? People who don't have an employee who can put them on furlough, or can provide sick pay, or can provide flexible working hours. It's people who, like, if they don't go out and earn money that day, they don't have money to put food on the table. And I think what we realized about in the UK and all over the world was that there was a huge number of people in that situation. I mean, and more of them were women than men. Because women tend to have more of the informal sector jobs, more of the care jobs, more etc. And therefore, they were much worse hit. So then when you get into, like, is it single parent families, is it female headed households, I think that they did disproportionately get impacted by those income losses. And
can I just interrupt you very quickly with your global hat on, because as your expertise is global, did we perform, I don't want to rank anybody, but did we perform worse than anybody else in Europe? So I don't know the answer to that question, but I'm wondering if you do, when it comes to childhood poverty and food insecurity.
I don't know, especially on the gender. I certainly don't know the gender angle. I mean, I think the UK has performed worse in terms of our overall economic impacts, right? But I know there's some complications there, because there's some ways in which we measure our GDP that are different from other countries in Europe. So it's not that easy to say, oh, we're better or worse. But I do think there are there's been some policy choices made in the UK that have had worse effects in COVID. And I think people were talking in the chat about those decisions about austerity and cutting services and cutting benefits and seemingly like to sort of incentivize people to go to work, but in people working in a very insecure environment means that I think we have put more people into a more vulnerable position, so that when something like this adds an extra stress, I think we had as a country, we've got less good safety nets than we thought we had, basically. But I can't compare us. I don't have the data to.
Tamsin?
Just to come in on that, I think I know the data in relation to mental health better than I know the data in relation to food poverty, but the deterioration of our whole population, including children, school-age children, was deteriorating over the last decade. And, financial strain, however you measure it, is toxic to health, whether it's physical health or mental health. There is a socioeconomic gradient for just about every health condition, which we were hearing about earlier, the 10-year gap in Cambridge and various other places. We have a very unequal society. In terms of coming back to what's happened in the pandemic, mental health has deteriorated. across the age group, but younger people are doing worse, both in studies of adults, so emerging adults from 18 to 24, and food poverty was one of the strong correlates. It's cross-sectional data because we went back to a 2017 national survey in July, and we're going back again. Now, we weren't asking about food poverty in 2017, but I can tell you that there were many more children and young people with poor mental health in 2020 whose parents or themselves were reporting food poverty.
That's terrible. I'm learning so much. Thank you so much, folks. Continue putting your questions into the chat, please. Claire, can I come to you? You bring up an interesting perspective where in order to actually be able to tackle something like food poverty, you got to take care of all the, I say ancillaries, they're not ancillaries. They're a roof over your head. They're the ability to get to work safely. So going back to what policy, where have we gone wrong? let's I know it's a big question, but in terms of our policy decisions, I mean, how have we let this happen? What do we need to do in order to get the policymakers to try and sew up the holes in that safety net, in making these decisions about housing, about transport, just better and more secure for people?
That's a nice, easy question. Yeah,
I'm sorry.
That's on the other side. It's 10 years of cuts and income shrinking, and it's accepting the impact that has had, especially in terms of where you live and having somewhere decent to live. So even if you are in trouble and you do need to go to a food bank and you get a food parcel and it's got a tin of beans in and a microwave meal, and you've been living in temporary accommodation for 18 months, and you haven't got a microwave, and you haven't got a tin opener, and you haven't got a hob. You've got a kettle, and it's either that or going to the chicken shop, because you're on the housing list, so you've been in this temporary accommodation in a room forever, and the money you have got, you're spending on bottled water, so that the kids can wash their hands without having to use the dodgy shared bathroom in the B&B. And it's realising the impact of that's what housing policy, or a lack of housing policy, that's the situation it puts people in. So then when you try and intervene with anything to help, because if it's food or if it's fuel or education, it's like trying to help children with school when they've got nowhere to do their homework. If we haven't got an acceptance of where that policy's led up to, then any efforts to intervene are so complicated.
Sorry, I keep muting myself. Sam, can I come to you? So we had a bit of another hoo-ha. And this time came from, well, I think it probably came from someone before Jack Monroe, but then Jack Monroe caught on to it about the fact that during that food parcels were being sent out to family. And I think many of us saw some of these frighteningly terrible food parcels. But I guess I think it was you that was talking about dependency, right? And I guess what is the question I want to ask? I guess there is a difference between giving someone the chance to make a decision about what they want to feed their family with some kind of either a voucher system or actually cash, compared to someone actually handing you a box of food and says, this is what you gotta eat. I mean, what is your view? I know what your view on that, but can you expand on your view on that?
Yes, I mean, I think that there are many sort of community responses. One of the largest response in the country is the Trust food banks, and they've been there and they support people. And by dint of the work that they do, they need to hand a box of food to people. There are other initiatives set up all over the country, be they independent food banks, be they like community food hubs in Cambridge, that allow people to pick and choose. And there's been an absolute outpouring across the country of small community groups, community responses to the issue. So be that boxes of cooked food, or be that fresh produce. I mean, here in Cambridge, we've teamed up with a local community farm who's donated over 40 tons of fresh produce this year. So fresh fruit and veg, and parents tell us they want fresh fruit and veg. That is what the response is that they are missing. So I think it's a it's a different approach for different situations, and I think that sort of question about, well, what can we do to, you know, what can we do going forward? And I think there are, building on these community responses that have gone on across the country. So, for example, we've been encouraging people to grow a row. So quite simply, grow some extra food. If you're growing food, then donate it to your local food bank and it will go out to people. So say teaming up with Cove Farm, but also teaming up with local businesses who've been cooking food. But the question of dependency is a big one, I think, and you'll get a different answer from different people. And it's not something that I've spent a huge amount of time trawling through. I mean, local communities will say, well, why shouldn't neighbours be dependent on each other when they need some support, be that food or anything else? But then you end up with community groups such as ours or the Alliance having to find money to keep those food hubs stocked with food. And
then you're taking over the government's job, should it be? I mean, that seems to me a ridiculous situation to find yourself in.
Indeed, yes, without funding. And, you know, a lot of the funding for those groups was there at the beginning of this crisis. There was a lot of money made available for community groups and community responses, but obviously that's being rolled back and suddenly, you know, is not quite so generous going forward over the next, you know, into the next financial year, which means that, yes, you do have an issue of, well, what do we transform it into? How do we keep these networks going? How do we keep this amazing response? And the community connections as well, people who will go and talk and make friends and meet people. And how do we keep all that going with limited funding and funding that's being rolled back? So it's a big question, I think.
Tamsin, can I just come to you? You mentioned about the rise in eating disorders, just as an example, during in younger people. That's where they're seen often because of COVID. Has there been any? Well, I don't know if you know the answer, but has there been any systematic tracking of actually the psychological effect on kids with regards to the response to COVID being either put into particularly being put into food poverty? Has there been anyone actually looking at the psychological effect, the long-term issues that some of these kids are going to be suffering from?
I don't know if we lack data. I know that I'm not aware of any data that has tracked food poverty in relation to mental health. But I think sadly, with the economic impact that we are seeing already, and it's not likely to get better, and I think it's disproportionate. So it is hitting those who are least able to withstand it hardest. And I can't see that changing either with the response that we have currently. I think we really should be. Because there's a group of really vulnerable children and families who are just, you know, they didn't have much of a rug to stand on, but what little rug they had has just been, you know, pulled from beneath them. And I think, I'm not an expert, but from what my understanding of people who are living, you know, in that very hand-to-mouth way, is the reason we need a safety net is that it gives you the headspace to be able to pull yourself up and find a job, or, you know, to support yourself better. But if your whole mind is preoccupied by how do I feed the children, how do I make sure that, you know, people have, you know, my children have clothes to go to school in that sort of, you know, are close enough to the school uniform, etc. If your head is full of that, then it's very difficult to do anything else that might improve you or your children's situation.
So I've got some questions here. I'm going to try and merge some of these questions together. And what's interesting here is somebody's asking, well, look, there were some people who were on benefits and were in trouble before COVID hit. And what COVID did was obviously then tilted more into them. And suddenly these, the ones that were COVID poor, suddenly didn't know what to do. They didn't know who to access. They never had to do it before. They were caught up at the edge. Suddenly they went below the wrong the wrong side. And how the various organizations you work with. So this is an open question. I mean, have you seen how have you been dealing with this? I don't know who Yolande. I know you're not the is that the wrong person? Let's go to Anna first. Let's go to Anna, and I'll come to Yolande. Anna, what is your view on this?
Can you just say the question again, Giles? Sorry,
yeah,
I just didn't quite catch it.
Yeah, so I guess the point being here that how do we get into a situation? Let me see if I can actually clarify the question. Someone is trying to draw a distinction between the people who are on benefits to begin with, and suddenly are tilted into poverty, whereas others are not actually on benefits at all, but still can't actually afford food. And I guess how do we deal with them separately? Do them all the same? Because the government seems to think of them separately.
Well, I mean, I think. Yeah, so basically there'll be a lot of people who are working, who are visiting food banks, and because their wages aren't enough. So this is not just a problem of the benefit system, it's also a problem of low wages. And in fact, what's interesting is we've been specifically looking at food insecurity reported amongst people who are working in the food system. So whether that's working on the checkout in a supermarket or working in a factory, making food, or any part of the food system. And we found higher levels of food insecurity amongst people working in the food system than the general population. And what we've seen in the last 6 months, thankfully, is 1 or 2 supermarket chains, the Co-op and Morrison's in particular, who have said we're going to up our wages of our staff and get close to the real living wage, which is obviously a level that's higher than the national living wage, and a level that actually the Real Living Wage Foundation estimate you can live off. So I don't think we necessarily need to be dealing with the problems differently, but there are obviously 2 different kind of key routes to getting to the point where people can put food on the table and know that they've got enough income and they will continue to have enough income without that level of uncertainty over their heads.
So I've got another question for you, Anna, since I just spotted it. This is from Crispin Shingler, who asks, having been a witness to a parliamentary select committee, is the government listening? Are they able to piece together the wealth of data from the variety of charities who have collected it on the subject of food insecurity, poverty, and destitution? You know, are people listening at all?
Well, yeah, I mean, there was a number of important announcements that were made in November, specifically around holiday provision for children and also extending the Healthy Start scheme. So there's definitely been some good signs that the government is taking this issue seriously. I think on the data point, one of the things which hasn't really happened is we don't really have a home for this problem in government. We don't really have leadership where you've got a part of government that is analysing the data. I mean, we, for example, show that in our data that households where there's a disabled adult or somebody living with a health condition which really limits their activities, they experience 5 times higher greater levels of food insecurity, and that difference has widened significantly since pre-COVID. It was bad pre-COVID and now it's even worse. Now that, for me, just when I look at our data, I mean, it comes through, you know, and I'm looking at it thinking, how can we be in a situation where we've let this happen? And I don't feel that we've got in government a mandated bit of government that has oversight of data and is trying to make sure that whether it's local authorities, civil society, or core government policy is actually plugging some of these gaps. So I think there's definitely a leadership problem, but I think we have seen some important commitments made. There's a long way further to go, though.
Okay, question from Hillary, and this is to the panel. So whoever wants to answer to this first would be just raise your well, just answer. Is there any way the state, or a state for that matter, can ensure that children can get access to food every day apart from the need to support the family unit? So I guess this is the question. I mean, should the focus be on the child to try and get food to the family unit? What is the most efficient way that a state can actually do, any state, to actually act on this? I don't know if anyone wants to try and answer that question. Anybody out there? Yolanda?
I mean, I'll try and answer, like, again, on a global level. I think the most efficient and effective means of supporting is to, you know, if you're going to say what's your one solution, I would say have some kind of a child benefit or some, you know, cash transfers to households. And obviously that's just the one answer and it doesn't do everything. I think if you're going to say the other thing you need is a government that says we're committed to reducing child poverty and hunger, and in that commitment, as Anna was saying, we need a multi-dimensional approach. It can't just be one thing. And we know that governments can do it. And I'm not a Blairite, but, you know, Blair set that commitment up and actually did achieve a real reduction in child poverty and hunger over that period. We're seeing now potentially in the US a government that wants to set a commitment to doing that. And I think if you set a commitment and a target, then you start to put in place policies that create what you want to achieve. And I think the combination of, I mean, I do think cash transfers are amazingly useful, and you can combine them with great other forms of support, because I'm really against the stigmatization of low-income families, as has come up multiple times. You know, so many times, you know, most parents want the absolute best for their children and will try to do that for their children, and they are struggling against, like, low wages, you know, high cost of healthy food, you know, multiple jobs that mean they don't get home in time to cook a healthy meal for their child, etc. And so we need to try and do, you know, rather than stigmatizing those households that are struggling, to look at what is the range of simple policy interventions that will help most families. Then you also still probably will need food banks and, you know, other schemes, because you're never going to get a perfect system. But what I really fear at the moment is that we're finding far too much reliance on the, you know, the non-systematic responses that aren't really the most efficient and effective way to deal with people, and they're crumbling under the pressure, and there isn't enough funding available. So anyway, I hope that's a helpful thought.
Mm-hmm. Anyone else want to add anything to that? Okay, so there's another question here from Kumar. Do we know or have data on how food poverty is spatially distributed across the UK? So what's the geographical spread of food poverty? Is there a north-south divide? Is it an urban-rural type scenario? Anyone can answer the question? Claire?
Hi. Yeah, just to say that I can't answer the question because I can't do it, but I've got a colleague, Diana Smith, who does, she's done a paper on estimating factors related to food poverty and food poverty risk through the UK. So if you Google her, she's at Southampton. She's done a series of lovely maps where the bits that are at greater risk are darker, and it's very nice and easy to follow for people like me who don't follow the other parts of it. So I would have a look at that.
Okay, thank you so much, Claire. There's a question here, Jenny, which maybe I'll direct to you, Sam, from Jenny Gage. How should food banks' model of operations help people whose food poverty is not an emergency but chronic, given that they are set up for crisis prevention? So in other words, you don't necessarily have everything you're not a supermarket, everything available all the time. So do you have can you answer that question or speak to that question?
Yeah, it's a many-pronged approach, isn't it? I think the food banks are there for people that are in crisis. There are very strict criteria around usage of them, and they are there for crisis. The chronic situation that we have in Cambridge and elsewhere across the country is just that, it's chronic. It's people do not have enough money to buy the food or pay the bills. I mean, different place in Cambridge particularly, we have exceptionally high rental market. Housing, as anybody who lives in Cambridge will know, is exceptionally expensive. The amount of income versus private rental is huge. So and there's a gap, and I think the you know, either all those the community responses that have been filling that gap for you know, for the past 10 years, since austerity has bitten over the past 10 years, step back, and you know, you look at the extent of the actual the the size of the problem, because I think there are throughout the UK people working tirelessly just to make sure people get fed. So I often wondered what would happen. What would happen if all the food banks went on strike and we all went on strike and marched through the streets? Because I think there's a whole charitable community sector behind this supporting. I mean, we can have that conversation about whose responsibility is it, but I mean, at the end of the day, it comes down to economic priorities, I think, and where you want to spend the money.
Which I'm going to interpret what you just said, that last statement, what you said, and you can sue me if you wish. That I think all poverty, but let's focus on childhood poverty, given that this is what we're talking about. I think that childhood poverty is a choice. Now, not by us. I don't want but by the people who can do something about it. I mean, is it not a choice? Is that not the only explanation from what we're doing now? Anyone want to disagree with me or answer? Tamsin.
I don't want to disagree with you, but I just want to enlarge on that comment. I think if you had a Martian arrive and look at our culture and how we manage things, that they would be left with the opinion that we look after our most vulnerable people in prison. Because, you know, if you're not educated and you're not fed and you've got no qualifications, you can't cope in school, you end up excluded, you end up in county lines. So, you know, a lot of our most vulnerable children and young people end up, particularly the boys, in their late teens, and particularly those facing other adversities like from the care system or from ethnic minority groups. They do end up in young offenders institutions or prisons, and that is about the most expensive way you can look after somebody. So it really is a case of a stitch in time with Save 9, and it's, you know, I think you can probably hear it in my voice. I probably ought to shut up now because I get hugely frustrated with the short-sightedness of a system that won't support children who struggle to read or won't support children who don't have enough to eat. You know, to cope in order to be able to be functional adults. And it costs so much more if you don't put the support in during childhood.
Any other anybody want to comment on this poverty as a choice as a choice comment? I think I do think I think, be it bad planning, be it priorities. I hate the word priorities because I can't see a bigger priority than feeding the children. But there we go. That's just that's just me. If you're thinking about whatever the hell the other priorities are, I just get the feeling that they are the wrong priorities. I'm staying apolitical. I will stay apolitical. Right. We've got another question here in LMIC. I don't know where the LMIC is. Educational. This is from Marjorie Lima du Vale. I'm sorry, I killed your name. I really apologize for that. In LMIC, educational interventions play an important role in reducing malnutrition along with other interventions. What role would they play in preventing the rise or the continued presence of malnutrition here in the UK? Anybody want to comment on that? Otherwise, Yolande, go. Yep.
I can comment briefly because I know LMIC stands for Low and Middle Income Countries.
Oh, thank you.
So
thank you so much.
I think it relates to what I was saying about like our evidence base is, you know, you need a cash plus other things, right? So you need, you know, infant and young child feeding practices. So like one of our best returns on investment is to support breastfeeding in low and middle income countries, for example. That could prevent, I think it could be the single largest way of preventing deaths in children under 5, I think. So I think there is a role, and I do think the UK, we are lucky with our health service and things that people mostly do get access to, you know, those kind of supplementary services, like health services are free in the UK, which isn't the same in many other countries. But on the education side, I'm not sure whether she was referring, or the intervention was referring to. I mean, there are a lot of other, you know, school feeding programs and things. I'm not sure if they were talking about that. I feel, this might be a bit controversial, that there's a bit of a mixed evidence base about school feeding. I think, you know, it can be really helpful if it's sort of nutritious food. It can sometimes not provide additional meals for children, but substitute for meals. You know, that's the trouble. When a child is getting a meal at school, that can mean that they don't get breakfast at home because the parent knows. I mean, this is not, again, stigmatizing those families, but it's just the choices they're having to make in very difficult circumstances. So I will be a bit cautious sometimes about school feeding. It may not be automatically the best choice for children, and I think you have to look at the evidence and what works in different.
So can I just ask, we have a few minutes left, can I ask almost a very, very brief statement from each of you, with the opportunity to either address Parliament, address the policymakers, to the people that actually can do something about this. I guess, what would be your 2 to 3 sentences that you tell them? What would you tell them? I mean, I don't know who wants to start first, but everyone should have a go at just answering this question. Anna, did you want to start?
Okay, I will start off. I think we need to fix some of the problems with the benefit system, the 5-week wait, the benefit cap, the 2-child limit. There are a bunch of things that need to be fixed in the benefit system, as well as continuing the £20 lifeline to help family income. And I think we need to do an urgent review of free school meals. The COVID pandemic has kind of acted like a flare. It's revealed lots of the problems with the free school meal system. And I think we need to do a review, and we need to quite urgently look at the income threshold for which children become eligible, because too many children are living in poverty and are not entitled to free school meals.
Claire, what would you tell your PM if given the opportunity? You know, just what can you do to help?
I think it would largely echo what Anna said. So yeah, fix the benefit system, particularly the kind of the punitive weight of proof and kind of tendency towards disbelieving. So it's a more supportive system, definitely. And then those basic social determinants of health, like housing and education and employment conditions, I think if you do those, a lot of the food problems will start to right themselves.
Sam?
Yeah, I would echo another, I guess. Echoing, I would also like to see the Healthy Start voucher become automatically available to those that are eligible, rather than them having to apply through an antiquated system. So that would be my main takeaway: is let's get the Healthy Start voucher working for people. Plus, actually looking at it backwards, think about how much it actually costs to put food on the table, and then work it from there. That, you know, that I know that the Food Foundation have done some great work around, you know, how much does it cost for the Eat Well plate to put on the table, and if you look at it, you can see it's just totally unavailable to some people. So, you know, start with how much a plate of food costs, and then work it backwards.
Tamsin?
I absolutely endorse everything everybody else has said. I think we should stop assuming that people who are struggling with poverty are there because they want to be, because so often they're not. And if people are having to work several jobs and still cannot put food on the table, then there is something very broken about our society. We're a rich country. We should be able to feed our children.
And finally, Yolande, give an international bent to the answer.
I think you're going to be, you know, we're all too much in agreement, but I think it is. I think that the international evidence is clear, as well as the national evidence, that, you know, it is a choice, and, you know, countries can make policy choices and really work towards ending child poverty and hunger. And I've seen it happen. You know, it's happening in places like South Africa and Mongolia, and it should be possible that it can happen in the United Kingdom if we've got the political commitment to do it.
So listen, we have now just gone past 7 o'clock. So first of all, I want to thank our fabulous panel, Claire, Yolande, Tamsin, Samantha, Sam, sorry, I don't want to sound like your mother, and Anna. Thank you so much for sharing your thoughts with us. I have learned a lot. Thank you to the audience for having a really active chat. This has been fantastic. And I do think this is just last editorial before I shut it off. I think I do agree, in this rich country, as a 6th richest country in the world, you know, I do think that poverty is a choice, and is one of political inexpediency or unwillingness to move. And I think that it should not be acceptable to anybody in society. And I think that all of us here on this need to, in our own way, make sure that the people that can make it, well, we can make a change in our own selves, but we should be able to reach out to our MPs, our policymakers, and try make a difference in that way. With that, thank you so much, everybody, for being here on a Monday evening to listen to us about this. It's been fantastic. Happy International Women's Day again. Thank you to our panelists, and have a good evening, everybody.